Recording in progress.
Hi everyone, Doc Allie here. Today we're going to be doing another rendition of Family Table Talk with the PV edition. I have on the call today my dear and sweet friend, Dr. Nemeka. Would you like to introduce yourself?
Hi everyone, my name is Dr. Okorie. As my wonderful friend Ali said, I'm one of a former PV grad.
Okay, Dr. Nemeka, today we're just going to be talking about your journey to, currently you're in ortho residency, correct?
Yes, I am.
Okay, so we're going to start way back. Let's take it back to the PV days, MCAT Prep. What happened back then?
Back in time. What was that?
For MCAT Prep, back in undergrad.
Yeah, what about, okay, so, man, that was quite a long time ago.
Yeah.
Yeah, that was back in time. But, I don't know, I felt like MCAT Prep was a very challenging time for me, but I think, we were, lucky to have the resources provided by the Undergraduate Medical Academy of PV. So I can't quite remember how long I took to prep for the exam, but I thought it was quite a long time because I was a little paranoid that I wanted to do well so I could get into medical school. But I ended up having to actually take the test twice.
Oh, really? I didn't know that.
Yeah, because my first attempt, was not very favorable to what I liked, and then I had to take it twice, and even that, I think I improved like maybe 5 or 6 points, and I was like, hey, I'm just gonna go with it, But I used the Kaplan and then Princeton exam reviews to study for both exams. Took as much practice exam as possible, and
How else did you build your med school application? Extracurriculars, classes, all of that.
Yeah, so I really think that one thing that I believe helped me with my med school application, and this is something I would definitely recommend for all pre-med, is just get involved with research. I mean, I don't think it's like required to in your application to be accepted into med school. I just think it makes you a more diverse applicant. Given that my MCAT wasn't as strong, I felt like what still helped me get into med school was being diverse in my application. And I was involved, I think after my freshman year college, there's some after my freshman year college, I was involved doing research with one of our anatomy professors. His name is Dr. Alfonso Keaton. Worked on like hypertensive research with using mice models. So I thought that was really, really helpful. I was also involved in chemistry research. Got a couple publications on that as well. I was presenting my research, so that helped build my application. And I was also the vice president of the Undergraduate Medical Academy for 1 year, so that helped. And I was volunteering. I don't know if you recall, the House of Help.
I loved House of Help.
Yeah, so it's like what is it? It's like a
thrift shop / food pantry.
Exactly. So I did that multiple times. I think it's like every weekend, every other weekend. I was volunteering, and then just also other volunteer opportunities that was available. Try to get myself involved, while still trying to balance my academic, obligations. So I really think the research, the volunteer helped, and in terms of leadership position, other than the medical academy that I was involved in, I wasn't really involved in a lot of leadership position. But I really think that's instrumental. I think everybody should strive to be involved, because it not just helps you your application. I think it really helps you as a person build your leadership skills, because down the line you'll realize that in med school it's important to have some kind of leadership characteristics. And even in residency as a doctor and beyond. So I think that's a very essential skills that is important, and it's important to start as early as you can. You don't have to be the president of an organization. I think even if you're a secretary or a parliamentarian or any other, leadership position, I think is important. Ideally, obviously, president, vice president, secretary, but it's not always required to have this. Just be involved as much as you can in organization, but not also trying to stretch your stuff too thin.
Definitely.
Like getting involved in too many. You want to involved in the organizations that you care about the most, because those are organizations that I guess when you're doing interviews, they'll ask you about, and if they see that you're really passionate about these organizations, it shows that this person is actually interested. They're not just like trying to, get involved in everything, which I was guilty about a little bit.
Okay, so then you ended up at Howard University School of Medicine. What happened there? Like, were there more extracurricular activities? What did you do?
Man, the first year of med school, man, is just survive, man. Like, I mean, so first thing first, like med school, you will hear this many times. It's like drinking water from the fire hydrant. There's a lot of material that you have to learn in a very short amount of time. And every school is different. At Howard, we were taking tests every week, Yeah, we had a major test every week, and in between the weeks, we would have like quizzes. I think quizzes every day or something. And then every 2 weeks is our major exam. That has significant points percentage that is worth towards your actual grade. So you had to do well. So there isn't a lot of time to be involved into something like significant. I mean, you can, but you have to really be good at time management, which is another skill required to be successful in med school. So my first year, I wasn't involved in any per se leadership position. I was involved in organization as a member because I wanted to expose myself into different organizations that were in the med school, because I was a brand new first year med student, so I wanted to learn about what the school had to offer in terms of organizations. So I was involved, but I wasn't in any leadership position, because being in a leadership position requires you to execute. You can't be lazy, so I didn't want to have to sacrifice my study time for that. So I was just a member for a lot. And the only leadership position I had as a med student is it's called I forgot the title of the position, but basically my role was if after every exam, during our med's first year, we had to appeal some med students have to appeal questions that they felt weren't fair. So my job was to be like a liaison between students and attending to kind of talk to attending like, hey, like the whole class don't like this question. Can you remove this from the exam, or at least give us extra points, or just so that was my position, which wasn't required. It was 2 people per for that position, so it was nice, the distribution of labor. So it didn't require like a lot from me that straight from my academic obligations. So, but other things I was just involved in just as a member. The one thing I felt that was exciting and substantial during my first year, it was actually after my first year, the summer right after my first year, I did a missionary trip to India.
Oh wow!
It was about 10. Yeah, it was about 10 days, and I did think it kind of I guess emphasized my passion for global health. Like we didn't talk about this earlier on, but I was born in Nigeria, raised there. So growing up, I did see, a lot of poverty and a lot of lack of healthcare resources, and I remember in Nigeria, my uncle was involved in global health. So he would bring American doctors to my village, to, provide, healthcare, so being able to go to India during med school was actually like, it's like a deja vu, So I really loved that experience, and allowed me to, give back to the community, and, really emphasize my passion and interest for global health. So I think that's one thing I did during my freshman year that I was really, really proud of, in med school.
So let's talk seriousness, full transparency. You have 3 mistakes that you made during this journey and 3 things you're very proud that you did. What are they?
Wait, say that one more time.
You have 3 things that you did that you regret, 3 mistakes, 3 things that you're very proud that you did.
As during med school?
Or any time along this journey.
Okay. So let's start with, I guess, mistakes.
Yeah, start with the negative, end with the positive.
Let's start with the negative. All right. So I guess one mistake, if I have to call it a mistake, is, throughout this whole journey, is caring too much about, how others felt about my goals or my, academic routes. I remember, throughout my undergraduate years at Prairie View, I would kind of care too much about what, how people felt about my performance. Like if I didn't do well on this exam, like it's almost like it's not just my journeys with other people, and that put a lot of stress in me because I felt like I had to perform really well all the time, and each time I underperform, I become very stressed, and I was very hard on myself. So I think the first mistake I would say was just putting too much stress on myself about what other people think of me. So I think that in life, it's your journey, and you shouldn't care about what people think of you. You shouldn't care about if you underperform. It's okay, and failure is actually welcome. It's okay. I remember even for the MCAT, as I mentioned, I had to take it twice. It was a very, very emotional, to the point I had to shed a few tears because I cared about what the director of the medical academy thought of me. I cared about all that stuff, and that put a lot of stress in me. I cared about what my mentees. I had a lot of mentees that as a senior in Prairie View, how they felt. Oh man, like I felt like I disappointed them. So I think in life you just have to focus on your goals, focus on your own journey, and just do it. So that was my first mistake. I guess second mistake, I guess I noticed this during my first year of medical school, is stretching myself too thin, right? So again, I remember what I was saying, getting involved in organizations, and I said I was guilty about this. I was so I was involved in organizations as a member, that I was involved in pretty much most of the organization at Howard early on. Part of me is really just curious. I'm a curious person. I want to be involved and learn what other organizations have to offer. But that put a lot of strain and stress in myself because, I felt obligated to kind of attend a lot of the meetings, and that would take away a lot of study time. So I think stretching myself too thin is one second mistake I would definitely highlight, because you just want to focus, man. Like do the 1 or 2 organization that really matters to you, and that's important. And I guess the third mistake, let me think. I guess the third mistake I would say was I wasn't as focused on my first year in med school. And what I mean by that is, I would occasionally study late. As I said, we had exams every 2 weeks, major exams every 2 weeks. Yeah. And occasionally I wouldn't start studying to the weekend before the exam. And man, when I tell you that stress was too high, imagine, we had so many lectures all the time. So I would have like 20 lectures to watch in 2 days for the exam that is a Monday. And that was not, and then occasionally or multiple times before the exam, I would have like maybe 5 to 10 lectures that I didn't watch, and I still go into the exam, And yes, I still honored a lot of, my courses and passed, but I think I would have done a lot better academically if I was more serious and more focused in my studies.
Right.
So I think that would be the third mistake, So again, to recap, don't worry about and don't focus about what people think of you too much. That's number one. Number two is don't stretch yourself too thin, right? By being involved in too many organizations. And number three would be staying focused, because med school, as I said, is like drinking water from a fire hydrant, It goes beyond trying to pass exam. I think when people get into med school, most people then know how to study to, be a good doctor, learn. It goes beyond passing your exam. It's actually a learning.
Right.
Because these are stuff that sometimes some of the things you learn you probably see once in your life. Because, again, I'm an orthopedic surgery resident. I'm focused on bones and muscles and ligaments, I'm not learning about, gallstones, but these are stuff that, it sure as an intern, first year resident, I learned about some of these, but I wouldn't really have to worry about them that much, So it's important to, whatever you think you're gonna learn for the first time, and you should just try to make sure you learn as much as possible. So I think that's definitely the third mistake, just being focused on learning as much as you can and not being distracted, because I think there's a lot of distraction, especially being in DC. DC is a great city. There's a lot to do. So,
I used to be so jealous watching your Instagram.
Yeah. I guess what I'm proud of is the other end, right?
Right.
The things that I'm proud of. All right. So the first thing that I'm proud of is recognizing that, this journey is my journey, alone. And what I mean by that is, again, it goes back to my first mistake. I realized that I cannot worry about what people think of me. So I had to reframe and change my mindset and be accepting of myself and who I am as a person and my strengths and weaknesses. So I got to a point where I became so proud of myself that, wow, I don't have to worry about what people think about how I'm performing. I don't have to worry about literally what nobody thinks. I just focus on myself. So that's something that I'm really proud of. Being able to, work on that. So that's one. Number two is I really noticed a significant progression in my academic goal, focus. Like after my first year, I realized, hey, I can't be, messing up. I can't be, not focused. So I became so focused, so laser focused in studying that I started seeing improvement in my, academic grades. I started seeing, that I was learning really, really well, So I think that's the second thing, just being focused, And the third thing I'm proud of, I guess it's a combination of multiple things, to be honest, is being honest with yourself in terms of, I guess this is in terms of your career goals, right? Choosing the path that I am right now, being an orthopedic resident. I'm proud of the fact that I recognize that, my interest in medicine earlier on in terms of my subspecialty. I battled this because earlier on I didn't really know what I wanted to do. I thought I wanted to be a neurosurgeon. I was pretty much, gonna apply neurosurgery up until the beginning of third year. But I was proud that I was able to keep an open mind. So I think that's the bottom line. Keeping an open mind and knowing that anything can change. So I was able to keep an open mind and, look at me now, applied to orthopedic surgery residency, to something that I'm actually very, very passionate about. I'm very, in love with. So yeah, keep an open mind, because you might go in wanting to do one thing and then come out something else, And that was me. Even before starting med school, I told myself, man, I'm gonna be a neurosurgeon. Like, there is no questions. I didn't even consider any other specialty. Like, for me, it was surgery or I don't do medicine at all.
Right.
So I wanted to be a surgeon. That's the bottom line. So, and then it was neurosurgery, but I kept an open mind. I was like, hey, you know what? even though I wanted to do neurosurgery, let me explore other fields, right? Let me explore orthopedics. And I shadowed one of my orthopedic attendants. It was a trauma. She's a orthopedic traumatologist and deals with trauma fractures of the bones. And went into a case with her, and man, it seemed like magic. I love the instant gratification of orthopedics. A patient comes with fracture, you fix it, and they can go home the same day. Or like arthritis, you change the joints, they can go home the same day, like or the next day. I love the instant gratification compared to neurosurgery where the patients are much sicker. So I really loved my experience, and yeah, I think that would be my I guess starting that I'm proud of, just keeping an open mind.
Okay, so I think I'm gonna go next to positivity, and then we're gonna come back to how you chose ortho. So, this man in undergrad, I would be like a gray cloud would be over me, and I'd see Nemeka, and he's smiling from ear to ear almost every day, the most positive man I've ever met. Let's talk about that, because in med school, you really do need that. How do you maintain such a positive mindset?
Wow. How to maintain a positive mindset. I mean, I think the first thing first is, knowing what you're doing. Right? Again, you have to be very passionate about what you do. You have to be very passionate about medicine, if that's what you want to do. I think, that saying, how does it go? I think it goes, if you're very passionate about what you do, right? It's like you never feel like you work a day.
Oh, right. Yeah.
So I felt like what helped me being positive in mind, in med school was because first of all, I love medicine. Like I had to tell myself, is there any other thing I could see myself doing other than medicine, And the answer always came out to be no, right? I mean, don't get me wrong. Like, if there is no such thing as medicine, sure, I could maybe be a business person, but it will feel like a job. Like it won't feel like something that I'm super, super passionate about, So I think medicine is that thing that just goes beyond yourself, It's not about money. It's really about people,
Right.
So you have to be very passionate. So I think for me, I was just in love with medicine, and that really helped me be very positive, because I knew what I was pursuing. I knew what I was doing. So you have to know what you're doing, and that should bring you happiness if that's what that should bring you excitement, even in the dark times, because there will be dark times, man. When you feel so stressed, there's multiple things to do. Everybody's wanting this from the left and right. So, I think that really helps. The second thing is, you have to surround yourself with people that you care about, people that love you,
right,
their support system. And I felt like my family, my mom, my dad, my sisters, they were so supportive, and they're like my biggest supporters, So that really makes me happy. Even when I'm, I feel like I don't want to study, I don't want to do, my mom is like, hey baby, she calls me baby, it's like, I'm rooting for you. She's always supportive. So surrounding yourself with that, your the community of people that support you, I think helps. And my friends, Howard is such a wonderful place. It's such a unique place where you're surrounded by people that look like you, and not just that, but people that are just supportive, good people.
right.
So I really think that helps go through, because I have I had a little tight knit group of friends. My roommates, we would study together for even step 1 and step 2, man. We were roommates. We were in the same cohort, same class, so we studied the same things every single day. We studied together. My friends, we would celebrate each other's birthdays together, surprise each other, literally my friends. So I think having that that community is such an intricate part of life, it's so important, So I think that helped me stay positive. And I guess finally, I think positivity has to be also part of you in a way. I think naturally I'm a very optimistic person. Sometimes that's a good thing. Sometimes that's not so much of a good thing. So yeah, so I'm like so optimistic to a point that it's almost not realistic. I think everything is possible. So I really think that just helps me like get through life. Like even when things are going bad, I believe that you know everything always works out at the end.
Right.
One of my really good friends, mentee, she always says everything always works out at the end. Works out at the end. If it's not working out now, that means we're not at the end yet.
Right.
So that really helps me keep moving. So I think
Okay, so last to final question. How did you decide on your specialty, and how did that whole application process go?
As mentioned previously, I had to keep an open mind. I was gonna apply neurosurgery, but I think keeping an open mind really just puts you, in a position to, honestly be successful in life because, you never know what God planned for you.
Right.
You just really have to, be accepting and just kind of go with the flow in a way. So I decided to end of my second year, pretty much the summer, beginning of my third year, right before third year started, I decided to shadow, some of the orthopedic attending. I shadowed Dr. Wilson, who is the program director, and I shadowed Dr. Nwankwo, who is the orthopedic traumatologist. And I'm telling you, man, like it was an instant, like, yes, this is it. It's like when you find the thing that truly makes you happy, So yeah, I think with the case that I did with her, man, it was like an open reduction internal fixation of I think it's a comminuted fracture of either this, mid shaft femur or tibia. I can't remember which bone, long bone it is, but the bone was in pretty much, multiple pieces, and I saw she pieced together the bone, like, with bone clamps and like X-ray, like, and after the surgery, the reduction was perfect. And I was like, wow, like, because as a med student that don't know anything about orthopedics, I saw this bone, I'm like, yeah, this person is not walking again. There's no way. And then literally in 2 hours, 3 hours of the case, and then boom, like it looks amazing. I was like, yeah, this is what I want to do. Like, I love that instant gratification. That's always one of the things that drove me into surgery rather than medicine, is because I wanted a specialty where like I can fix it and it's done. So, and that's how I ended up deciding orthopedics. And then once I decided that, now it's figuring out, okay, how do I get into orthopedics? And man, hearing that orthopedics is probably one of the toughest, if not the toughest specialty to match from med school, I was like kind of a little defeated because I felt like it was too late, because orthopedics, for you to apply orthopedics, most people that apply orthopedics know from even before med school or earlier on. So because it's a very, very like, I guess tough specialty to apply into. So they need research. I had like 7 or 8 publications, but they were not orthopedics related.
Right.
So I felt like, man, it's too late, because you can't really get, it's hard to publish meaningful research within a year as a med student, maybe as a research fellow, but one of the other options is to take a research year. I didn't really want to do that. I just kind of wanted to go in. So I felt like that was one of the challenge, and then academic, performance, like, you need to be in the top of your class, or, so I felt like, okay, I was like, above average in my class, but it wasn't like, AOA status, which is also something that it's not required, but it's, really good to have when you're applying to some of these really competitive specialties. And then step scores. So my step one, I did above average. I can say my step one score was a 237, so that's good enough to get into most specialty. But for orthopedics, like dermatology, and all these high, really competitive specialties like plastics, you have to back that up with other stuff. So I felt like, man, like the pressure was on, because I only had 1 year, So step two was a way to improve upon that. So I had to study my ass off, like literally, like beginning of third year, I did nothing but study, man. Like I was studying pretty much every day. And then when I started, during my dedicated, I had to think about how I could improve from my step one. You know, it was tough, man. I was studying every single day. I did like maybe I'll probably say at least 12 to 15,000 questions, during my third year. More than that. I did as much I did like UWorld. I finished UWorld like twice, you know.
Wow.
I did Kaplan. I think I did like 70-80% of Kaplan. And then with all the MBMEs you took throughout, third
Mm-hmm.
year. And then I took all the practice exams for the MBME, both the old retired ones and the new ones. And every
Mm-hmm.
single question I could, you know, I lay my hands on, I did all those questions. And then I had to improve on strategies. So that helped me get into the 250s for step two. So which is like, good for orthopedics. So that's one. And then honestly, just connections. Orthopedics is a very small specialty, as in tight specialty. So it's who you know. So I have to
Mm-hmm.
start reaching out to people, emailing program directors, telling them I'm interested in the program, telling them to keep an eye out my application, and some of them would respond and favorably. And then away rotations. It was also during COVID, so nobody was doing away rotations. Nobody wanted you in their program because, COVID. It was 2020, right? So
Mm-hmm.
yeah. So yeah. But we were only allowed to do one rotation. Traditionally, applicants can do two, three, or more, depending on your program. So we were only allowed to do one away rotation in addition to your home program. So that's the only two things I did. I rotated at Thomas Jefferson, with the Rotman Institute, which was a great experience. There I learned a lot from them. So I think that's, so research. I try to get involved in research. I started my own research project, but that was so late that there's just no way to get publication. It's still ongoing. I still put it in on my application because I had some data, but it wasn't published by the time of the application. So research, step, and then grades, doing well
Mm-hmm.
in my grades, and then honoring some of the courses that are important, and then volunteer is important. I started volunteering. Like Howard had a COVID little clinic. It was one of the major places in DC where people were coming to volunteer. I volunteered and I was giving vaccine shots, to
Mm-hmm.
people. So that was one way to kind of boost the application and just help out the community. So yeah, and then during application season, man, I mean, I was lucky, I was able to get 14 interviews, which is above average, and yeah, and then just interviewing with programs and just hoping for the best. And the way the ranking works is you rank the programs, they rank you, and the computer
Mm-hmm.
shuffles it, and you just match wherever you match. So was lucky to match, and I matched at Howard, my home program, so which has been pretty good so far, and so yeah.
That's great. So, to close this out, I'm going to ask you one last question. If you could talk to little Nemeka, what would you tell him about his future?
Oh man. Yeah, man. Yeah. What would I tell my little self? I guess it would be, stay consistent. You know,
Mm-hmm.
I think consistency is key. Especially allows you to stay in the game. You can get little, flares of motivation here and there, but you have to be consistent even when you don't want to do it. I mean, don't
Right.
get me wrong. Like as being in med school is tough. Tough as in not that the academic it's hard. It's just like you look around, we went to PV together. I looked at all my friends that are not in medicine, they're living their best life on the next flight to whatever island,
Right.
people were traveling,
Mm-hmm.
living their best life. People were buying homes, driving nice cars. It
Mm-hmm.
was tough to look at some of this stuff. So sometimes I had to delete Instagram for months, because
Right.
you can't get distracted from that. So So it's important to stay consistent
Mm-hmm.
when you don't want to do it or when you're tired,
Mm-hmm.
So I think that would be one thing I would tell my old self, my little self: consistency and discipline. I think discipline, man, like you have to, I think that's one of the important qualities you have to kind of have throughout your life, because if you're not disciplined throughout the whole process, you're gonna fall short.
Right.
Discipline allows you to, go above and beyond. So I'll tell myself to stay consistent, disciplined, and always, always stay positive, you know, regardless of how tough things are, you know, because there's a light at the end of the tunnel. Like it's not always bad. So
Right.
yeah, yeah.
Thank you so much. You have been a great blessing to this channel. Your positivity, your tips for residency, everything has been great. Yes, I'm using this for my own self too, so it's not just for y'all. And
Hey man,
I just like to say thank you. And I speak on behalf of PV and anybody else. We're so proud of you and we're so happy with all you've accomplished.
thank you so much. I'm proud of you too, man, because we started this journey together. You know what I'm saying? Like
Right.
it's been a long journey, but as I said, there's a light at the end of the tunnel, and we're gonna be in attendance very soon.
All right. Thank
Yeah.
you.
Thank you.